Hi, everyone. Welcome to our ICARE Case Conference today. I wanted to go ahead and introduce my friend and colleague, Dr. Debbie Cragun. As I'm introducing her, what we were going to do is also do a very, very brief poll of 2 questions to kind of give us an idea and give you all an idea of how many people are performing tumor screening related to Lynch syndrome, as well as where in this process germline testing happens. So with that, please complete the poll, and then Debbie will go through this. So Debbie Cragun is an assistant professor at the University of South Florida and director of the genetic counseling program there. She has many areas of research. She is an implementation scientist, a behavioral scientist, a board certified genetic counselor, and has a lot of expertise in healthcare services delivery. So with that, I'm going to pass the presentation along to Debbie. Debbie is going to just go through a few slides first and then show you live the tool that they've built around universal tumor screening. So Debbie, take it away.
Okay, thank you very much. I'm excited to present this work that we've been doing for quite some time. And I'm mostly going to focus on the toolkit that we developed for implementing and optimizing Lynch syndrome tumor screening programs. This is part of a much larger grant, and I wanted to give kudos to all of the individuals who have helped with this process here, including Alana Kolchak-Ram, who was the PI. Oh, yay, we've got the poll. All right. I'm seeing that 95% of individuals do tumor screening for Lynch syndrome at their institution. And 5% said they did not know. Have you considered taking patients directly to germline? We have about 37% who've been thinking about that. Excellent. So I'll show you why that might be a little bit relevant. I wanted to kind of see where everyone was. So most of you have already implemented, which I actually thought may be the case. But this toolkit is also about optimizing your program. And you'll see why I asked about taking them directly to germline, because there are some resources there to consider that also. So what we did is we used implementation science to compare Lynch syndrome screening across multiple healthcare systems. We did interviews with multiple stakeholders at each of these various healthcare systems to get a sense of what they were doing, what was working. We had some healthcare systems that had not even started doing tumor screening and others that were already doing it. And we took a look at how their processes were going. We wanted all this information so we could create a toolkit to help with implementing, maintaining, and improving the Lynch syndrome screening. So what we did is we looked at the processes that people used, and as you are well aware, there are several different steps that have to go on when you're doing this tumor screening, and we identified some process gaps and inefficiency that you can see here. And there were essentially 5 of those that we really identified from this process mapping. So then, using the process gap and inefficiency, we went ahead and we looked at these process optimization factors. So really, they're just the inverse of the gaps and inefficiencies. So we wanted to see, are these sites doing IHC and MSI consistently? Are they referring to genetic counseling consistently? Are they doing routine reflex testing to hypermethylation or BRAF? And is there evidence that they're tracking the outcomes and conducting some quality assurance to make sure patients aren't missed or there aren't holes in the process? So you can see here we had several sites, several institutions, and we had 4 sites that were fully optimized, meaning they got all 5 of those points with those factors that I just presented. Then we have several sites that were what we call non-optimized, and then we had 4 sites without a program. So our goal of our data analysis was really to identify what was differentiating these different sites, what was different about the sites that might be helping to explain some of this. And we looked across, and as you can see, pretty complicated, but there are some clear patterns that we were able to identify. And we used those findings to create a toolkit. I show one of my students here because she was instrumental in helping with developing the toolkit. The toolkit was really designed to encourage the decision to start universal tumor screening. We also wanted to help in that planning process, all the how-to and what to think about. Then based on the information we got from those sites that were optimized and those that weren't, we included some information that we thought might help people to optimize their programs. And then people were saying, okay, well, when is it time to just stop all this complex process and go straight to germline and see when that might be the case? So there was a component of this study that did some economic analyses that is also part of the toolkit. So I'm going to go ahead and I'm going to share my screen because I want to show you the actual toolkit. I'm not going to spend a lot of time on it, but it will be available on the Lynch Syndrome Screening Network website soon. We just found a few additional quirks that we need to, and bugs we need to finish up and finalize, and then we will open it up and anybody will be able to access it through the Lynch Syndrome Screening website. So as you can see, here's the toolkit with some instructions. You can click on any of the side menus over here, but I'm going to go ahead and go to home. Since some of you are thinking about other approaches to identifying Lynch syndrome, I'm going to go ahead and go there and just show you a little bit. So we have our universal tumor screening, direct to germline testing, and tumor sequencing with then germline testing are some approaches that were looked at. So you can click and compare approaches. This data came from the economic modeling that was done, and you can actually even go in and use the economic modeling tool yourself. You can put in your own costs and your own data and customize it and make it applicable to your site. So you can go in and say how much the cost is for germline testing, let's say, and we have some default settings in there, but you can adjust those and make it very applicable for your own. And when you do click on these, they actually take you, as I said, to another screen where you can actually download this information, and you can download the whole economic modeling tool. It's essentially an Excel document that has a lot of the things pre-populated, but then allows you to adjust certain things. And there's a video demonstration of the tool as well. I am happy to answer some questions or go look at a few different things. At the very end, we do have some printable items. So if you didn't want to use the website, you can go ahead and print different things out.
So Debbie, I have a question.
Yeah.
A lot of times cost is like, I know we as genetics professionals think about this, but it's also something that the administrators also are very cognizant of. Did you have stakeholder input from the administrators? You know, also from a patient standpoint, what do costs look like? So I know they're broad, like I'm broadly asking a question, but in terms of like, there's different stakeholders, right? There's the provider, there's the administrator, there's the patient. And so how does that be comment?
Yeah, this is really geared more towards administrators or the system level, the institution level. And it's really looking at and allowing the different sites to look at their particular costs. So if they have some of the IHC in-house and their costs are different than what the default costs are, they're able to make those adjustments. But this does not look at costs for patients. This is really an organizational level tool.
There are a number of questions here. The reference from the initial publication in 2018, if you can make that available, and we're happy to send that out.
Yeah, I'm
as
happy to
well.
send that out. We have some stuff in press. This is not published yet, but we're trying to get at least the tool out there quickly so that people can start using
that's
it.
the other question. Will the toolkit website link be shared to bookmark for later or sent to us by email? We can certainly send out that email. Debbie, if you have a quick, is it accessible through the LSSN website, or?
It will be. So again, I said we had to adjust a few additional things, and then it's going to be put onto the Lynch Syndrome Screening Network website, and then anybody can access it very easily.
Can anyone access it right now?
If they have the link. So I'm okay with you sending out the unofficial link, and people can start taking a look at it, but just know this is the beta version. The full version will be on the Lynch Syndrome Screening website soon.
Okay, and then we have another question. For direct germline testing, a GC was not involved, correct?
No, they did put in costs of genetic counseling.
Okay, and then did you assess direct testing for Lynch syndrome only versus larger panel? I don't think you did.
No, I don't think so. But again, you put in the costs of the germline testing. So if you want to adjust that, you can. Again, there are defaults, but you can go in and customize it. And that's what was kind of novel about this, is people can make it very specific to their own system and their own costs. So if you have a deal with labs on how much you pay for IHC or how much you pay for the germline testing, you can put in those.
Okay, perfect. All right, so we will move on. Thank you, Debbie. That was great.
Yeah, thank you.